Hypothyroidism. Hypothyroidism is a condition of the body wherein our thyroid gland is not creating enough thyroid hormones for the body. Now, from the past two slides, we know that thyroid gland is the gland which actually looks after the whole metabolism of our body. And when thyroid hormones are considerably in less amount in our body, it is understandable that our body metabolism would be really slow. Let us peep into what is the difference between a healthy thyroid and a hypothyroid. Now, if we look at figure 1, it is the cycle of hormones that is going on for a healthy thyroid. From the pituitary gland to the thyroid gland, there is a considerable amount of TSH being produced, and to the response of it, T4 and T3 are being produced in the same commanded amount. And the same T4 and T3 from the bloodstream goes back to pituitary, showing that there is no more need of T4 and T3 to be now produced, so the pituitary stops sending TSH, so that the messenger will be stopped and T4 and T3 production will also be stopped. But if you look at figure 2, the amount of TSH sent by the pituitary is non-stop, while T4 and T3 are very less. This can be because of multiple reasons: damaged thyroid or thyroid suffering from any other problems, or maybe it is just a hormonal imbalance. We will know that further. Symptoms of hypothyroidism. There are multiple symptoms of hypothyroidism like hair loss, eyebrows, puffy hair, enlarged thyroid, dry skin, constipation, and slow heartbeat, poor appetite, infertility, and even carpal tunnel syndrome. Now, if you look into it carefully, you would know that not everyone has all of these symptoms. Some of them have some of the symptoms, while some might even just be suffering from one or two of these symptoms. In the cases where the patient is suffering from far less symptoms, then in that case, it is very difficult for the patient to understand that he or she is suffering from hypothyroidism. And the major symptom of hypothyroidism is weight gain and memory loss. How is hypothyroidism diagnosed? Serum TSH is taken. What I mean by serum TSH is, it is a normal blood test. A patient gives some amount of blood for the testing, and serum is separated out of that blood in which TSH is present. And from that blood, from that TSH, if the amount of TSH is considerably elevated, if you see on the left hand side, you will know that elevated TSH is then further tested for iodine, and if the iodine is normal in elevated TSH, it is called as subclinical hypothyroidism, and if it is low, then it is known as primary hypothyroidism. And the rest of the chart is representing hyperthyroidism, which we have already seen in the part of hyperthyroidism. Cause of hypothyroidism. There are multiple causes of hypothyroidism, out of which 6 are stated here. First one is previous surgery. In this case, the patient has been already suffering from any of the thyroid ailments in which the thyroid gland has been enlarged, or he or she was suffering from goiter or cancer, because of which the thyroid gland had to be cut out. And in that case, the number of cells of the thyroid gland are reduced, and hence a very less amount of thyroid hormones are being secreted by that thyroid gland, and hence making the patient hypothyroidic. Now, if you see the second part, it says about overtreatment. In this case also, it means that the patient is already a dysfunctional thyroid patient, and before this, he or she was suffering from hyperthyroidism, for which the patient was having some treatment. And because of that over treatment, now the thyroid production has been reduced, and now the symptoms that the patient is showing is of hypothyroidism. Now if you look at the third part, it is damage to the pituitary gland. Now that we have studied so much about thyroid, we know that pituitary gland is responsible for bringing out the stimulant or the messenger of thyroid hormone secretions for thyroid gland. Now, if the pituitary gland itself is not feeling well or is not being able to produce TSH, then thyroid gland will also not be producing enough thyroids. Now look at the fourth. It is nutritional deficiency of iodine. In the first part, we have seen the working and the production of thyroid hormones. In that case, we know that T3 and T4 are having 4 and 3 molecules of iodine in them. Now, if there is deficiency of iodine, the cycle of making of T3 and T4 will not be completed, and hence the body will be deficient of thyroid hormone, making the patient having thyroidism or hyperthyroidism. Now, if you look at the fifth cause of hypothyroidism, it is defective development. It means that the fetus in the mother's tummy itself had hypothyroidism. Why is that so? Because the mother herself was suffering from hypothyroidism. Now, the last part is when the body starts making antibodies. Well, it is one of the diseases related to thyroidism, and we will be looking about it in detail in the upcoming slides. What it means is our body starts making some antibodies which is fighting against the thyroid cells, and it leads to hypothyroidism. Now, the dangers of hypothyroidism are varied. But let us see that how it is so dangerous. Now we know that pituitary gland is responsible for secreting TSH, and when this TSH is being secreted back to back, because the pituitary gland is not getting a negative feedback that the body is having enough T3 and T4, that is because the thyroid gland is not being able to secrete T3 and T4 even after multiple messages from the pituitary gland, then in that case, due to the overproduction of TSH, the thyroid gland becomes enlarged, and hence making the thyroid gland have goiter, that is enlarged thyroid gland. In certain cases or rare cases, there is severe life-threatening dangers of hypothyroid, that is heart failure, coma, and even sudden cardiac arrest. Now we know that in hypothyroid, the patient is most probably or in most of the cases iodine deficient, and hence the diet should include regular high iodine rich foods. Which are those? Let us see that. In a hypothyroidism diet plan, a patient must include seaweeds, coconut oil, fishes, berries, all kinds of beans, all kinds of berries, probiotic rich foods, a lot of water, milk, or dairy products. Any dairy products is very good, and high fiber, very high fiber foods, that is fruits and vegetables. That's that about hypothyroidism. Let us see what we are going to see next. We are going to see why there are these very rare occurrence of weight gain in hyperthyroidism. We all know that hyperthyroidism has the main symptom of losing weight and spending up extra energy. But in what instance does hypothyroidic patients gain weight just like a hypothyroidic patient? All these questions would be answered in the upcoming parts. And if you want to know about the diet plans of hypothyroidism and hyperthyroidism patients, then you should stick on. Please hit the bell icon and subscribe my channel. This is Dr. Gargi SG Panikar. If there are any questions so far, please feel free to ask. Keep watching, keep asking, keep learning. Thyroid disorders would be coming up next. Till then, do healthy, be healthy. Like, comment and subscribe my channel. Thank you.